We have reached an important milestone, but I want to explain why we need all this testing. Back in March, the country moved into lockdown because the virus was circulating widely, not because we did not have enough tests. Cases were popping up with no obvious connection to other cases, and the infection was entering the exponential growth phase. And at that point, access to limitless testing, even if we had had it, would have made no difference. The decision to enter lockdown would have been the same and would have been taken at the same time. In the same way, the route out of lockdown has not been blocked by low levels of testing. We can relax social distancing only when the government's 5 tests are met, and that means particularly getting the infection rate right down. Testing will, as Secretary of State has mentioned, help to keep it under control once we're out of lockdown. But our levels of testing have not kept us in lockdown a day longer. What about Germany? People talk about Germany a lot, but yes, Germany had a lot of tests available from the get-go. But there was also a lot less virus around in Germany when they introduced social distancing, and it was circulating in younger people. So, as CMO pointed out in an earlier briefing, we should not rush to draw conclusions about relationships between numbers of tests available and outcomes in different countries. Nevertheless, as CMO also said, we are learning from other countries, and we have learned from the experience of other countries. But back to the here and now, where does all this leave us in the UK? Well, the 100,000 tests a day target was set for 2 purposes. As Secretary of State has mentioned, it was intended to motivate the programme and set the scale of our ambition, and it has certainly done that. More importantly, though, perhaps, we knew from our calculations that we would need something like this level of testing to be ready for the next phase of the response to the pandemic. Looking to the future, then, we now have a very substantial and flexible testing capability in the UK. It will be used to drive extensive contact tracing to control any new infections, to help us keep patients and staff safe in hospitals and care services, and to tell us with some precision how the virus has spread across the country and is spreading in the future. If we can quickly identify who may have been in contact with someone infected, we can prevent them from passing it on and so drive down transmission rates of the virus. Now, the new NHS app for contact tracing is also in development and making rapid progress. And the more people who sign up for the new app when it goes live, the better informed our responses will be, and the more effective we will be in keeping the virus under control. All this progress with testing and with our design of the next phase of contact tracing and the app frees ministers and their scientific advisors to choose whatever future strategies are best suited to keep the country safe. I can assure you that the testing capability we have built in the last few weeks is world-leading in its scale and sophistication, and gives us the flexibility we need. As the pandemic evolves, we will have the testing capacity to meet changing demand across the country. It is now there to serve us all. Thank you.
Thanks very much, John. And Professor Pass, if you'll take us through the slides.